The role of patient preparation in FDG-PET-CT scans. After today's lesson, you will be able to better understand physiological FDG uptake, the Randle cycle, pathological FDG uptake, as well as how patient preparation improves FDG-PET-CT scan. Let's see how FDG enters cells. FDG is glucose analog. Both FDG and glucose are hydrophilic molecules that require transporters to enter cells through the lipid cell membrane. The molecules compete for the same transporter. An important group of membrane transporters is GLUT family. For example, GLUT1, GLUT2 and GLUT3 are found in red blood cells, brain, liver, pancreas, and kidneys. Transport is dependent on glucose concentration. GLUT4 is found in muscle cells and fat cells, and transport is insulin dependent. Transport through GLUT4 in muscles can additionally occur during vigorous exercise regardless of insulin. Transport in brown fat is as well activated by the sympathetic nervous system through beta-adrenergic receptors. The Randle cycle refers to a metabolic process in which a low-carbohydrate diet leads to a reduction in insulin levels. This results in downregulation of GLUT4 transporters in skeletal muscle, heart muscle, and brown fat. As a result, there is a decrease in the unpredictable physiological uptake of FDG in the affected tissue. Let's examine the mechanism of glucose and FDG transport in pathological conditions. The transport in cancer cells and in inflamed tissue depends on increased expression of GLUT transporters as well as increased hexokinase. The uptake mechanism in the inflamed tissue is more complex. It is additionally caused by increased perfusion, increased migration of immune cells, and increase of cytokines. The aim of FDG-PET-CT scan is to visualize the uptake of FDG in all pathological conditions. Understanding the principles of glucose transport allows us to summarize the effects of patient preparation on the quality of PET-CT scan. Fasting and normoglycemia are important to minimize the amount of glucose that competes with FDG uptake. Furthermore, dietary preparation helps to minimize endogenous insulin secretion. Low insulin level and low carbohydrate diet have been shown to reduce physiological FDG uptake in muscles and fat tissue. Avoiding vigorous exercise further decreases physiological FDG uptake in muscles. The patient should be kept warm to reduce physiological FDG uptake in brown fat. Pre-medication may also be considered. In conclusion, patient preparation plays a crucial role in increasing the amount of FDG available for uptake in pathological conditions. Here is a case example to illustrate the point. This patient is known sarcoidosis and was evaluated for potential cardiac involvement. PET-CT demonstrated manifestation of sarcoidosis in the lungs, lymph nodes, liver, and bones. The patient followed instructions regarding low-carbohydrate diet and fasting, resulting in no physiological FDG uptake in the heart muscle. No abnormal FDG uptake was observed in the heart either, which led to the conclusion that cardiac sarcoidosis could be ruled out. Thank you for your attention.